The latest now on Indianapolis head coach Chuck Pagano and the announcement today that he's fighting cancer.
Battle and get this disease in remission, and it's a marathon. There's no question about it.
Colts owner Jim Irsay talking about head coach Chuck Pagano today and his diagnosis. No doubt he's now facing a tough new challenge, and everybody's wondering, well, what's ahead for the coach? Well, joining me now to talk about the disease is Dr. Pablo Bedano. Thank you for joining us. He's a medical oncologist with the Community Health Network. Now, doctor, let's talk about Pagano's specific illness. It's kind of a big name. It's acute promyelocytic leukemia. What's the typical treatment for this?
Well, usually the treatment entails a combination of chemotherapy and drugs such as all-trans-retinoic acid, which is a vitamin A derivative, and a drug called arsenic trioxide.
Now, the first 4 to 6 weeks are crucial, Dr. Bedano, because that's when he goes to the chemo. He's going to be in the hospital. Is that right?
Yeah, and that's what we call induction remission, which is we use chemotherapy to reduce the amount of cancer cells in the body.
Okay, and then he's not out of the woods. I understand it's maybe a year or two of more treatment?
We do then something called consolidation therapy and then maintenance therapy for about a year.
And is that continuing with the chemotherapy pills? Or?
Chemotherapy pills and a pill called Atra.
And how tough is that on the body? People are wondering, is he going to be on the sidelines next year, or does that take a toll?
Well, I'm not involved in his direct care,
Sure.
but I think the toughest part is the first few months, in which, especially this next month, which is the induction treatment, and would mean that he would have to be in the hospital for the whole month, pretty much. And then after that, the with the consolidation treatment, that may make it hard for him to continue his activities. But hopefully, for next year, with the maintenance treatment, and if he remains in remission, then he should be able to resume his activities.
He's, I think, 52 today or tomorrow. Is that typical to get leukemia at that age?
Well, for this type of leukemia, age is not. I think he falls within the age group. We see it though in older or younger people. It's a leukemia that can happen pretty much in any age.
They said the coach is in pretty good health, but they said one of the warning signs that he was in trouble was he had bruising on his body and he was fatigued. He kind of ignored it, saying, I got it on the field, or I got it wrestling with my grandkids. Is that an easy tell for doctors?
No, it's not an easy tell, but it's the most common way that this type of leukemia presents. And unfortunately, even though it's a very curable, treatable type of leukemia, the reason that people sometimes die of this is initially they have severe bleeding before it's caught and treated in time.
And so in terms of the coach's prognosis, if things go well, he could beat this?
Yes.
That's good to know. All right. Dr. Pablo Bedano, thank you for joining us today. We appreciate your insight, and of course, a lot of prayers going out to the coach tonight.
Absolutely, and definitely the biggest thing is that there is hope. He can beat it, and we have faith he will.